Good evening, everyone here. We are honored to have Dr. Shilpa Rao, a dental surgeon by profession, with us today. She has been an endometriosis advocate and founder of Endostrongg. Welcome, ma'am.
Thank you so much, Yukta. Thank you for inviting me.
A lot of people are still unaware of endometriosis. How would you introduce this condition to them?
The apathy is that a condition which affects approximately 190 million people worldwide is still unknown. So if I have to introduce endometriosis to a common person, uh, it's a condition in which the tissue that's similar to the lining of the uterus, the endometrium, grows outside of the uterus. It's present anywhere else in the body except for the uterus. It resembles the endometrium, but it is not the endometrium. And it is typically present in the pelvic region, causing a lot of pain and discomfort. It is a chronic inflammatory condition affecting 1 in 9 people worldwide. And such a condition of such a massive, it involves so many people, but still it takes about 7 to 10 years for this particular condition to get diagnosed. Besides that, if somebody asks me, is endometriosis only a reproductive disorder? No, it is not. So this particular tissue grows on other organs like ovaries, fallopian tubes, the pelvis, the rectum, lungs, and in some cases it can also involve the brain. So that's what endometriosis is all about. Endometriosis affects the quality of life. It causes the particular individual having it to miss work, school, daily activities, and a lot more.
Thanks for this information. How did it affect your life, your daily activities, and your journey?
Yukta, if I have to tell you about my story, so it begins when I was like about 12 and a half and I had started my period, and it was always very painful. And coming from a very open background, my parents were very supportive. So they took me to the gynecologist just to be dismissed, saying that it's just a normal period pain and it'll be better as you grow. But things just went haywire, things just went worse, and the symptoms started persisting not just during the period, but 15 days, 20 days, 25 days in a month. So technically, it actually had made me miss a lot of activities while in school, while in college. In college, probably I couldn't say much to anyone because I was in a hostel and I did not want to be, to be deemed as somebody who is craving for attention. That's what I didn't want because I didn't know that I have a condition called as endometriosis because none of the doctors had ever told me. So as I grew up, I started fainting because of pain, and it just went on. And suddenly one day, when I was like about way back 2016, is when I suddenly had an emergency intestinal block surgery. I had a block in the intestine because of the endometriosis, because it was not diagnosed on time. So I had a stage 4 endometriosis. And how did it affect me? I had terrible chronic pelvic pain, painful periods, painful sex. I couldn't have kids, and the fatigue was like terrible. So these symptoms also hampered the ability for me to do everything that I love doing, in the sense I'm a dentist by profession, but there are days when I cannot work. And even if I have to push myself so much that it drains you. And this pain actually leads to a lot of anxiety and depression sometimes, because the pain just not doesn't affect you physically. There are a lot of mental and emotional symptoms which are involved. So that's how my life was with endometriosis.
There were a lot of struggles. So, what were the treatment options available to you when it was diagnosed?
So first of all, the diagnosis took more than 2 decades, maybe 25 years for the diagnosis to happen. And till that time, I think my savior was only the painkillers that I used to take. Uh, After the surgery, which was an emergency, and in the biopsy, the endometriosis was diagnosed. So after that, I was put on some injections called Lupron, which are GnRH analogs. So what that does is that actually shuts down your ovaries and it pushes you into a premature menopause. So it gives you all the other symptoms, all the menopausal symptoms. Post that, I think I took about 3 doses of leuprolide, and then I was put on contraceptive pills continuously. But it just didn't help, and I was going through a lot of side effects with those pills, and I was going through a lot of depression. But the doctors were not ready to listen to the problems I was having. Finally, in 2019, I went through a hysterectomy because I had adenomyosis also and an excision surgery. So, the gold standard for an endometriosis patient is excision surgery, which is still not advocated completely. You know, people still try to push a person into a medical line of treatment when it is not. A stage 4 endometriosis cannot be treated with a medical line of treatment. You need to understand the quality of a life of the person is getting involved. So you can't do that to patients, you know.
Thank you for that information. What might be the first signs that one should look for if they feel that they might be suffering from endometriosis?
So honestly, symptoms vary in person to person, but extremely severe period pain, which uh, doesn't allow you to go to school, go to work, okay, that confines you to the bed, is something which is not normal. Severe fatigue is not normal. But again, these are mostly the first symptoms, but it differs from person to person. But if your child or if anyone is complaining of excessive period pain, please let it be a red flag.
What are the misconceptions and stigmas about this disease, and especially in Indian society context, and how does it affect treatment?
So anything related to talking about menstruation is like a big taboo. So firstly, there are a lot of misconceptions that are associated with this disease, not only in the general population, but also in the medical fraternity. So the first is that endometriosis is just a bad period pain. Trust me, it is way different. Endometriosis actually causes chronic pain, and there are other symptoms that impacts the person's quality of life. The second is endometriosis is rare. It doesn't happen to a lot of people. 1 in 9 women has endometriosis. And I say endometriosis in women because other genders are also affected, but then they are not counted in the statistics. The third is endometriosis affects only women in the reproductive age. No, it does not. It is there is a study saying that endometriosis has been found in fetus also. It has been found in puberty or even after menopause. Fourth, uh, pregnancy cures endometriosis. Absolutely wrong. Fifth, endometriosis is caused by poor hygiene and lifestyle. Uh, One thing I need to tell anyone who's suffering with endometriosis: you have not caused it. You have not done anything which has caused endometriosis. So there are a lot of theories associated, but nothing concrete has come out as of now. Hence, I say more research is needed in this. So these are certain misconceptions I've kept hearing about, and I keep hearing about it from other people. So that's about it.
Hope that research helps us clear up these misconceptions and that this helps in
Yeah,
better treatment and diagnosis of this disease.
correct.
How do you hope to see awareness and support for this disease increase in the future?
I would be a little elaborate on this question. Would that be all right?
Yep, sure.
Okay. So now, since endometriosis is a complex disease, okay, it is debilitating and it affects millions. So now, how do we increase the awareness. The first is educational awareness and campaigns. First and foremost, we need to talk about it in the schools because there are a lot of kids who have endometriosis and they are not diagnosed. And imagine a kid suffering with endometriosis, not able to do anything and being dismissed. It actually affects them mentally because everyone of their age is able to participate in every activity of the school, but they are the only ones who are not. So they somehow they start feeling that there is something wrong with them. So the first and foremost is we have to start it in the schools. Second is social media, public events. People need to talk about it. The next is the medical training and education. We need a change in the medical training and education because endometriosis is a specialty. Okay, so the doctors have to be educated first to know what exactly endometriosis is, to diagnose it, and then to treat it. If the diagnosis only takes about 7 to 10 years, forget about treatment. The next is increased research funding, which I just said. More research is needed to better understand the causes, symptoms, and treatments of endometriosis. Um, Increased government and private funding for research and clinical trials would really be helpful because endometriosis has been prevalent for so many years and we still don't know the origin of it. I mean, I think it's a shame on the research that's happening on endometriosis. The next is support groups and patient advocacy. These patient support groups and patient advocates have to create a platform for the individuals to come and find support, make it a safe space for them to come out and talk about it. The government obviously has to fund the research and awareness campaigns. The government has to, implement policies which are pro women health because it is still considered as a women's issue. So I think you need to do. Again, in medical professionals, medical gaslighting has to stop. Start believing when the patient is saying that there is a problem. Start listening to them. And last but not the least, sorry, pharmaceutical companies again have a big role. They'll have to invest in research and development for new treatment of endometriosis. And also, in case they can find something which is non-invasive for for the diagnosis of endometriosis, I think the diagnosis will happen sooner.
I hope that this leads to a better change and we see more awareness and more research into this
I hope
condition.
so too. I hope so too.
We would like to proceed with audience questions. Audience, if you have any question, you can post. Ma'am, we have one question from Aditya. What would, in your opinion, be an ideal therapeutic for endometriosis?
See, honestly speaking, medical management is possible only in the initial stages of endometriosis. And what is generally seen in endometriosis is it is estrogen dominant. So mostly progesterone pills are what is given for endometriosis patients, and in some cases it does help.
Thank you, ma'am, for that answer. Those who have any queries can put them forward.
So I'll be very happy to answer if there are any questions. Please come out with questions because the more the discussion, the better it is for the awareness. I don't think we have a lot of questions coming up. Okay. No worries, no worries. Do you have any questions that you can think of?
Swaraj has a question. At what stage is endometriosis generally diagnosed?
Mostly stage 3 or stage 4, but staging and pain are two very different things when it comes to endometriosis. A stage 1 patient can have extremely severe pain, while a stage 4 patient sometimes doesn't have pain at all. They get to know of it only when they are trying for a fertility treatment, and then they get to know. So, but mostly it is about stage 3 or stage 3, stage 4 is something which is common nowadays. Again, diagnosis through a good MRI is something which is recommended. Besides, obviously, gold standard is a diagnostic laparoscopy. But if somebody does a really good sonography or an MRI and they're able to detect, then that's the best thing. You're not in for shocks.
Thank you, ma'am, for that good answer. What do you think is the reason why it is not diagnosed early, the endometriosis condition?
First of all, patients are not taken seriously. Okay, so when it comes to, there is something called as a gender bias in pain. It was a study which was done. So if a male has a pain and a female has a pain of the same level, the amount of attention that a male would get is much higher. So that answers my question. So it's mostly called as a women's disease. So women health per se is not taken very seriously. Okay, and women have this thing of being said to be getting hysteric about every single thing. So it's not taken seriously. But I think the doctors have to start taking people seriously, women seriously, patients seriously, not just women. Other genders also have it. So you really have to take people seriously, stop gaslighting, and listen to the symptoms, because when you hear the symptoms, the patient is telling a story and you exactly would be able to see where the story is going and whether it is an endometriosis or not. Secondly, our medical fraternity is not trained enough. There are very few doctors who do excision surgeries. Okay, so when you don't even know what to diagnose, what will you even see? Your eyes see only what your mind wants to see. So I think that's one of the major reasons why diagnosis doesn't happen at an early stage. And the third one is, obviously there is a stigma attached. People don't want to come out and open saying that I have some menstrual issue which is happening. So these are some reasons why diagnosis doesn't happen very easily.
Proceeding with this, we have some discussion questions, and
Mm-hmm.
there are a lot of social and economic structure in India make certain
Yeah.
to the disease.
Mm.
So we wanted to conduct a nationwide survey to better assess this problem.
Mm-hmm.
Uh, to design the survey, we have some questions.
Okay.
How should we reach a wider target audience?
So, reaching a wide target audience for a survey on endometriosis requires a lot of strategy. So, the first one, as I have said earlier, is social media. Social media these days is like big. Okay, Facebook, Twitter, Instagram, LinkedIn. These can be used to reach larger audience, and these platforms should be used to share information about the survey and encourage people to actually participate. The second is healthcare professionals such as gynecologists, obstetricians, and the general physicians. They have to be approached about this survey, and they can share this survey with their patients or on their pages. The third is patient support group for endometriosis. So they can be contacted and requested to share or promote the survey through their channels, websites, newsletters, etc. Online forums and communities are again very popular. So, you can put it up on Reddit or something like that, Quora, Reddit, anything like that. The next is email marketing. Send emailers to women's health organizations, hospitals, medical colleges, anyone who you think can help, you know. and request them to share the survey with their members, patients, students, or whosoever. And also it can you can actually put it up in the newspapers, radio stations, which are again very prevalent these days, and this will give a wider reach for the survey. It's also essential that the survey is easy to access and is mobile compatible. Okay, because most of them check their emails or anything nowadays on mobiles. Also, multiple languages is something which is recommended. And again, you can offer a couple of freebies like a gift card or a free medical checkup for people participating in this particular survey. So overall, reaching a wide target audience is something which is essential and requires a multifaceted approach. You know, so I think this would help.
This was very helpful. Thank you, ma'am. Uh, One more question. How do we make our survey sensitive so as it doesn't come out as offensive?
Oh, I know endometriosis. Talking about this particular thing might be pretty. There are people who get pretty offended, but first is you can use appropriate language. Use language which is respectful and empathetic rather than sympathetic. Okay, avoid using any derogatory language, any stigmatizing, or anything that can cause discomfort to the person. The second is provide context about the purpose of the survey. Let them know how the data is collected and how would you keep, how would you create a safe space for the person and make sure that their feelings would be respected and heard. The third is please include a trigger warning, because what happens is this is a very sensitive topic and a lot of people are going through a lot of trauma, right? So if you include a trigger warning before these sensitive questions, people can be mentally prepared that there is something which is coming up. The fourth is offer them resources. Tell them who is available for support, which patient groups are available, which mental health advocate is available to help them, and counselors, for example, to guide them through this condition. The next is obviously conduct a pilot study. I don't have to say this, but conducting a pilot study is really important because this helps identify any potential issues or sensitivities in the survey design. So this can also help refine the survey in such a way that it becomes more easier for people and more accepting. So that's about it.
Thank you, ma'am, for this wonderful guidelines. We surely implement them. What questions do you think should be included in the survey?
Question. There are a lot of questions, but I'll just stick to a couple of them. So the first question is, how have you been diagnosed with endometriosis? Second, how long did it take for you to receive a diagnosis after experiencing the symptoms? What are the symptoms that you experienced? How has endometriosis affected your daily life, including work, school, relationships, physical activities, etc.? Uh, did you try to take treatment or did you get treatment? And if yes, what kinds of treatments were given to you or they were tried on you? The next is, what are the challenges have you faced in managing endometriosis, including access to treatment, financial burdens, or stigma? The next is, how has endometriosis affected your mental health, like anxiety, depression, or stress? The next is, have you received adequate information about endometriosis, its causes, its symptoms, options of treatments which are available? Have you been involved in any endometriosis advocacy or patient support groups? Last but not the least, how could support groups and resources be improved for those with endometriosis in your community. So it's important that these questions are sensitive. Okay, that's the only thing. Additionally, the questions have to be clear and straightforward, and that will take care of most of the problems.
How, which communities, according to you, are at a greater risk of this running into this condition, and we should focus on?
It actually affects people of all ages and ethnicities and socioeconomic backgrounds, but communities which are at greater risk are women, obviously, because it affects women more. Um, Second is people with family history, people with reproductive health issues, uh, people of color in the sense people who are of Asian community, especially low income uh, communities because they don't have access to healthcare as much as it is needed. So it's actually important to consider these communities when designing outreach efforts. And by focusing on these communities, I think the access to the endometriosis care will be better.
Thank you, ma'am. Before we close, we have a few more questions. Question from Aditya. As someone who has seen many endometriosis patients, have you seen any correlation between family history of endometriosis and the chance of a patient having the condition?
Yes, uh, people with family history have a higher tendency of developing endometriosis. If you have somebody in the family, your mother, your grandmother, your sister, if somebody has it, you have a tendency. It's a higher tendency that you have.
And how do people from other genders get affected by endometriosis?
In a similar way, because it's a chronic inflammatory condition. So, what happens is this particular tissue produces its own chemicals, its own hormones. So, the same symptoms like pain, discomfort, everything that a woman faces except for the periods, everything is present in the other genders too. It's very similar. But unfortunately, they are not counted as much in the statistics, neither do they get good medical care because as women, we only don't get the amount of care that is needed from the doctors. So imagine what a person from the other gender would go through. It is very, very difficult for them.
Ma'am, your unrelenting strength will be a source of inspiration as we progress with our project aimed at designing a better therapeutic for endometriosis. Your recommendations for furthering research will surely help spearhead pure science research in endometriosis. We thank everyone here for joining. You have been a great audience. Thank you, ma'am, for your inspirational words and support.
Thank you so much for having me over. It's my honor. Thank you.